Excellencies, honorable ministers, and distinguished guests, I would like to take this opportunity to welcome you all to 64th Commission for Social Development side event titled Building an Inclusive Long-Term Care System Sustained by Social Solidarity, Darülaceze Model. Before I start, I'd like to give you an announcement that Ms. Keita is on her way and she'll be joining us very soon. I'm privileged to address the Commission. My name is Esra Ceceli Islam, President of Darülaceze. Today I wish to share a model from an institution that has been caring for the vulnerable for 130 years, a model that offers lessons for the world. Darülaceze, meaning Home of the Helpless, opened its doors on January 31st, 1896. From day one, it was funded entirely by social solidarity, including personal donations from the Sultan Abdülhamid II and Istanbul's Muslim, Christian, and Jewish communities, placing zero burden on the public treasury from the beginning. Our guiding principle has always been serving humanity without discrimination of religion, sect, language, race, and age. The most powerful symbol of this is in our historic campus. For 130 years, a mosque, a church, and a synagogue have stood side by side, serving our residents. We operate under a unique administrative structure, independent with a special budget, and yet monitored by the Ministry of Family and Social Services for the quality. We offer a scalable, self-financing model that has survived wars, economic crisis, and social change for over a century. We remain 100% funded through charitable donations and own source of revenues. We use a cross-subsidy model, donator residents who can afford to give contributions to guarantee their care, which funds the full care of residents in need who have no means of support. We have 2 campuses with various health, social, and rehabilitation services. The historic Ok Meydanı campus, operating since 1891, with a human-centered horizontal courtyard design. It includes clinics, 24/7 medical staff, and 343 residents are cared for. The new Arnavutköy campus, a social care city spanning 150 hectares with a capacity for 928 beds. It fuses tradition with modernity, featuring specialized centers for Alzheimer's, dementia, and palliative care as well. Our approach is holistic, combining health services, rehabilitation, psychosocial support, and vocational training. We are building our future vision on educational and technical pillars. We have partnered Health Science University to create a vocational school on our campus, and this creates quality care cycle where students train while serving residents, leading to become a certified employer. We are extending our compassion beyond our walls. Darülaceze accredited academy-trained caregivers will support the elderly in their own homes, ensuring dignity and autonomy. We are integrating smart health monitoring technology and modernizing our facilities to serve our 1,200 residents across both campuses. Our work directly supports UN Sustainable Development Goals, particularly regarding good health, reduced inequalities, and sustainable cities. As we face the silver tsunami of global aging, the question remains, how do we care for those who cannot care for themselves? Today, in this valuable panel discussion, we are going to look into answers and ways to collaborate for sustainable solutions. Darülaceze has been an answer that works. Our enduring promise is to serve humanity without discrimination for the next 130 years and beyond. Now I will let you see for yourself all about Darülaceze in our short film. Thank you.
In the heart of Istanbul, a door has remained open for 130 years, the Gate of Compassion. It stays open to offer those in need, without discrimination, a life worthy of human dignity. The story of Darülaceze began with an idea shaped by human care and solidarity. In an era marked by war, poverty, epidemics, and people left on the streets, a decision was made that on these lands, no one should be left exposed, hungry, or without care. A commitment that took root in 1890 became a true home by 1895. From its earliest days, Darülaceze has carried the same principle: service without distinction of faith, language, origin, or age, a humane mission grounded in dignity. Perhaps one of the strongest symbols of this spirit is here. In the same garden, side by side, a mosque, a church, and a synagogue, and the Pillar of Honor, representing the idea of living together. Today, guided by the same vision, Darülaceze serves across two campuses in Istanbul, the historic Okmeydanı campus, alive with memory, and the Darülaceze Arnavutköy Social Living City, established under the auspices of President Recep Tayyip Erdogan, building the future from today. Across these campuses, hundreds of residents are supported through a holistic system, from health and care services to rehabilitation, psychosocial support, and social life. Elderly care, disability support, and child protection and care are among our core service areas. Today, the world is rapidly aging. The need for long-term support is rising. Loneliness, vulnerability, and dependency are growing. Turkey is fully within this wave. That is why good care is not only a matter of place. It requires qualified professionals, shared standards, and continuous development. For this reason, Darülaceze is building an ecosystem, quality and standards in care, education and capability, modern institutional capacity, strengthened by sustainable financing, scientific capacity, and smart care solutions powered by digital transformation and artificial intelligence. With this approach, Darülaceze goes beyond being an institution that receives help. It is a model that invites society to share responsibility for the common good, and the legacy carried from its founding to the present continues forward as a commitment of care shaped for the future.
For their opening remarks, Her Excellency Mrs. Butayna bint Ali Al Jabr Al Nuaimi, Minister for Social Development and Family, State of Qatar. Floor is yours, and you have a 3-minute speech.
Thank you very much. Excellencies, ladies and gentlemen, I am pleased to participate in this side event on building an inclusive long-term care system sustained by social solidarity, which highlights Darülaceze as an example of good practice. Building a comprehensive and sustainable long-term care system based on social solidarity is a necessity in today's world, especially in light of the profound social transformations our societies are experiencing, such as the rapid population aging, increasing care needs, the growing prevalence of chronic illness and disability, and the weakening of traditional family structures. These trends are placing increasing pressure on care systems worldwide, which underscores the need for joint action. Excellencies, at the Second World Summit for Social Development in Doha, member states reaffirmed the centrality of social development and social justice, and the essential role of comprehensive social protection systems in achieving sustainable development. The Doha Declaration also emphasized the importance of integrated human-centered approaches that uphold dignity, equality, and accessibility for all, particularly older persons and other priority groups. Within this framework, long-term care emerges as a fundamental pillar of social justice and requires coordinated and equitable policies and rights-based frameworks. The priority theme of the 64th session of the Commission for Social Development, Advancing Social Development and Social Justice through Coordinated, Equitable and Inclusive Policies, provides a timely opportunity to highlight the outcome of the World Summit for Social Development held in Doha, particularly with regards to social protection and care policies, and to strengthen dialogue among member states on the ways to translate these commitments into practical policies and programs. The experience of Darülaceze in the Republic of Turkey offers a practical contribution and a pioneering humanitarian model for long-term care based on dignity, compassion, and non-discrimination. This demonstrates that comprehensive care systems can be sustainable and adaptable to different national contexts. Excellencies, the State of Qatar recognizes the importance of coordinated and equitable policies that link health, social services, and community-based care systems alongside the essential role of social solidarity and volunteer work in building resilient care systems capable of withstanding demographic and economic challenges. Qatar places social development at the heart of its National Vision 2030, enshrining the role of family as the fundamental unit of protection in society. The social development strategy launched by the Ministry of Social Development and Family under the theme From Care to Empowerment translates this vision into practical programs and policies to expand the scope of social protection and strengthen community participation. This strategy focuses on designing policies that respond to the real and diverse needs in line with the relevant international and regional agreements and standards. While we emphasize today the importance of exchanging experiences and best practices, we call for strengthening constructive dialogue and building partnerships between member states and stakeholders in order to develop rights-based long-term care frameworks that contribute to promoting social development and social justice and ensure that no one is left behind. To conclude, I would like to thank Permanent Mission of the Republic of Turkey and the partners of organizing this event. We look forward to the deliberations of this event contributing to the development of shared visions and practical recommendations that enhance the status of long-term care as a social humanitarian investment and a fundamental pillar for more just, equitable, and sustainable future. Thank you.
Thank you, Her Excellency. I invite His Excellency Mr. Adil Çalışkan, Deputy Minister of Family and Social Services, Turkey, for his opening remarks.
Minister, Deputy Minister of Countries, Ambassador of Pakistan, Ambassador of Turkey, and distinguished representative of the nations, United Nations and international organization, Excellencies, ladies and gentlemen. It's a pleasure to be here with you today at this side event where we are addressing one of the most pressing structural challenges of our time, long-term care. Advances in health service and medical science have significantly extended human life expectancy. Today, global life expectancy at the birth has reached approximately 74 years. As a result, old age has become the longest phase of the human life course. In the next 50 years, the global population age 65 and over is expected to reach 2.2 billion, exceeding the population under the age of 18. In the coming decade, there will be more older persons than children under 1 year of age. These developments show that the need for long-term care is growing worldwide. The increase in chronic diseases make this need even greater. After the age of 50, the number of the years lived with illness increases. Among the individual aged 70 and over, most years lived with disability are linked to chronic conditions. This situation makes long-term care systems and structural necessity rather than a choice. Dear participants, Turkey is all part of this global demographic transformation. In our country, the proportion of the older population has exceeded 10%. A significant share of this age group lives with at least one chronic condition. These figures point to a steadily increasing demand of care service in the years ahead. In this context, empowering health and social service system is not only a policy priority, but a matter of social justice. Long-term care is shared public responsibility grounded in human dignity. Access to care should never depend on income level or social status. Under the leadership of our President, His Excellency Recep Tayyip Erdoğan, Türkiye shapes its care policies based on principle of let people live so that state may live. Within this framework, the Minister of Family and Social Services leads to design and implementation of comprehensive rights-based long-term care system. Our main aim is to support older persons to live independently in their own homes for as long as possible. When this is not possible, we provide institutional care services. These services are designed to ensure dignity, accessibility, and quality. They include nursing homes and residential care and rehabilitation centers. Accommodation, care, rehabilitation, nutrition, and health service are provided together. Those who can afford it contribute to cost. Those in need receive services free of charge. Special care units address physical and cognitive challenges. Social and physical activities help prevent isolation. Digital literacy programs support elder persons in using the new technologies. International projects empower social bonds. Together, these initiatives reflect our holistic care approach. Within this policy framework, Darülaceze serve as long-established institutional example under the responsibility of our ministry. Its integrated structure brings together care, health, and psychological support. The model is sustained through public responsibility, philanthropy, and volunteerism. It's aligned to Turkey's national vision for a long-term care. Estimated guest. Established by Ottoman Sultan His Majesty Abdülhamid II, Darülaceze embodies a deep-rooted legacy of compassion and social responsibility that continues to guide our social care policies today. Sharing these experiences today is not only about the one institution. It reflects Turkey's border policy approaching to aging, care, and social solidarity. Long-term care is now in global social justice issue. The United Nations principle of leaving no one behind should guide our efforts. Long-term care should be seen as the core part of universal social protection system under the vision of our minister, Her Excellency Mahinur Özdemir Göktaş. Turkey will continue to empower its care policies. Our approach is comprehensive, sustainable, and centered on human dignity. Thank you.
Thank you, Mr. Minister. I invite His Excellency Mr. Hidayet Abdullayev, Deputy Minister of Labor and Social Protection of Population of the Republic of Azerbaijan. Floor is yours.
Thank you. Your Excellencies, distinguished delegates, ladies and gentlemen, I would like to extend my sincere appreciation for the invitation and the opportunity to participate in this important discussion on one of the most pressing and evolving challenges in social policy today, long-term care. Across all regions, aging population, longer life expectancy, the growing prevalence of chronic disease, illnesses, and disabilities, and the gradual weakening of traditional family support structures are profoundly reshaping our societies. As a result, both the demand for care and complexity of care needs are increasing, placing significant pressure on families, communities, and public institutions. In this context, long-term care has become a central pillar of social development, social protection, and human well-being. How societies care for those who depend on support is one of the clearest reflections of the commitment to social justice. It reveals the values that guide our institutions and the future we are collectively building. We are honored to highlight the experience of Türkiye Darülaceze, a unique institution that has provided inclusive long-term care continuously since 1895. For more than 130 years, across different historical periods and social transformation, Darülaceze has served individuals regardless of religion, ethnicity, gender, age, or socio-economic status. What makes Darülaceze particularly relevant to today's global discussion is not only its longevity, but also the values and the governance models that sustain it. The institution demonstrates that long-term care is not limited to addressing physical needs. It's also about safeguarding dignity, preventing social isolation, and preserving human connection at every stage of life. Social protection, the improvement of citizens' well-being, and the timely and effective resolution of social challenges constitute the fundamental priorities of Azerbaijan social policy. In recent years, strong development dynamics have been maintained across the social sphere, supported by presidential decrees and reforms aimed at ensuring reliable protection for vulnerable population groups. Azerbaijan has adopted the Azerbaijan 2030 National Priorities for Socio-Economic Development and Socio-Economic Development Strategy for 2022 to 2026. Their implementation has supported structural economic reforms, contributed to the realization of sustainable development goals, and strengthened the social welfare and protection system. Building on these achievements, work is currently underway to develop a new strategy for 2027-2030 in line with the new stage of socio-economic development. Between 2018 and 2025, 5 major social reform packages were implemented consecutively under the initiatives of President Ilham Aliyev, supported by additional 8 billion manat allocated from state budget. In 2024, social-oriented expenditures account for nearly 39% of state budget, increasing to over 40% in 2025, reflecting not only gradual increase of social spending, but also strong and sustained commitment to social development. Within this framework, the Social Service Agency under the Minister of Labor and Social Protection of Population plays a key role. The agency provides support to older persons, persons with disabilities, children deprived of parental care, low-income families, and other vulnerable groups through a wide range of mobile, residential, and semi-residential services. In 2025 alone, services were delivered to more than 3,300 individuals across 21 social service institutions, while rehabilitation-oriented services were provided to over 15,000 persons. In-home social services reached nearly 4,000 lonely older persons and persons with disabilities, and support was extended to repatriates, victims of domestic violence, and other vulnerable groups. The expansion of social service centers and the introduction of a new electronic social work management system further enhance the effectiveness and accessibility of services. Ladies and gentlemen, looking ahead, it's clear that building sustainable long-term care system will require more than incremental reforms. It demands integrated policy approaches that link health, social protection, employment, housing, and community services. It requires continuous investment in a skilled and protected care workforce and meaningful collaboration among governments, civil society, local communities, families, and volunteers. Most importantly, it requires strong political commitment based on a shared understanding that access to care is not a privilege, but a fundamental element of social justice and inclusive development. We hope that today's discussion will build on to the momentum of the 64th sessions of the Commission for Social Development and the Doha Summit, and will contribute to constructive dialogue, practical cooperation, and renewed global attention to long-term care. I wish you a productive and meaningful discussion. Thank you very much for your attention.
Thank you, Mr. Minister. Esteemed guests, I'm honored to invite United Nations Under-Secretary General and Executive Director of the United Nations Population Fund, Her Excellency Diane Keita, for her keynote speech. Floor is yours, Your Excellency.
Thank you so much, Madam Moderator. And please, audience, apologies for my lateness. Your Excellency Boutena bint Ali Al Jabr Al Nouami, Minister of Social Development and Family of Qatar. Your Excellency Adil Shaliskan, Deputy Minister of Family and Social Service of the Republic of Turkey. Your Excellency Rashad Mustafayev, Deputy Minister of Labor and Social Protection of the Republic of Azerbaijan. Excellency Permanent Representative, esteemed panelists, distinguished guests, all protocol observed. I thank the Republic of Turkey, as well as the State of Qatar, Austria, and the Islamic Republic of Pakistan for bringing us together today. I am delighted to address such a distinguished audience. You are all important partners in creating inclusive, resilient, and thriving societies that are committed to the health and well-being of older persons. Guided by data and evidence, the United Nations Population Fund works in over 150 countries to realize the full potential of all people. We firmly believe that active and healthy aging is not a switch that we can flip at age 60, but instead the result of lifelong investment in health and well-being. This is why we are focused on ensuring that every pregnancy is intended, every childbirth is safe, and every young person potential is fulfilled. Sustainable development cannot be achieved without a holistic understanding of population dynamics. We provide government with quality population data and forward-looking demographic analysis so that they can make informed and targeted investment throughout the life cycle. The data tells us that strong health systems are key. Between 1974 and 2024, the global share of people aged 65 and older doubled to over 10%. In the next 50 years, it is projected to double again. In that same time frame, the share of the global population aged 80 and over is expected to triple. Taking long view allows us to plan for healthy and dignified aging. Socioeconomic data disaggregated by sex and other criteria shows us the health and security condition older people are likely to face. Today, women outlive men, but spend more of their lives in poorer health and have less financial security. As we look to build inclusive societies and provide equal access to care, understanding the context of longevity is critical. At UNFPA, we work to ensure that the well-being of women and girls throughout their lifetime is central to policies, planning, and service delivery. We support the framework of the Madrid International Plan of Action on Aging, which promote active and healthy aging throughout life, access to long-term care and support for families, and creating society for all ages that addresses inequalities. Keeping a people-centered focus is critical. Our efforts must be culturally sensitive and address the specific healthcare needs of women, such as menopause or osteoporosis, and their heightened risk of abuse and violence, which continues throughout their lifespan. We must also bolster social support systems to alleviate the caregiving burden that disproportionately falls on women. Since women shoulder the burden of unpaid care, they are often in need of more resources and support. With longer lifespans and smaller pensions, they are more likely to struggle economically later in life. Long-term care is a multifaceted issue. It lies at the intersection of demography, aging, women's rights, and social justice. UNFPA encourages embedding long-term care within national social protection system to ensure an integrated response that delivers equitable care throughout people's lives. With this in mind, we pioneered two flagship initiatives. The first one is the Demographic Resilience Program, which assists countries with the strengthening their capacity to understand and anticipate population dynamics. It ensures that governments have the tool to manage demographic change with the ability to mitigate the negative effect on population shift and harness the opportunity they can bring. Our analysis also informs investment in human capital allows us to anticipate the skills required as populations become older. The second flagship initiative centers on rebalancing the care economy through family-friendly policies. We support countries in adopting systems for equity and in paid and unpaid care, creating opportunities for more formalized care that can reduce gender inequality and facilitate women's full economic participation. As we create compassionate care systems, quality of life consideration must inform where we focus our attention. We cannot ignore health and economic condition, education level, and the ability of those needing care to access new tools and technology. Intergenerational models of community support are key. Many older people become lonely and live isolated lives. Human connection isn't always quantifiable, but it is essential for our well-being. We commend Turkey for Darülaceze, a shining model that places dignity and public responsibility at the center of long-term care. Other countries could benefit from its best practice and experience. Sustainable care systems are a shared responsibility. UNFPA looks forward to working with member states to plan for dignified, healthy, and active aging supported by inclusive care system. To paraphrase a Turkish saying, please bear with me, Su akarken testeyi doldurmalı. One should fill the pitcher while the water is flowing. Let us seize this opportunity and build societies for all ages that value the contribution of older people and lay the foundation for active aging for generations to come. Teşekkürler.
Thank you, Your Excellency. For the panel discussion, I'd like to let my colleague, Ms. Elif Şentürkgül, to moderate the panel.
Your Excellency, Undersecretary General Ms. Diane Keita, Honorable Minister, Excellency, dear guests, welcome to our session. My name is Elif Şentürkgül. It's my honor to moderate this important session today. Regarding to research as birth rates decline, society are rapidly aging and the need for long-term care system is increasing. The high cost of care prevents many people from accessing professional care services. Therefore, it is crucial to develop long-term care model based on social solidarity. In today's panels, we will discuss what needs to be developed such models and examine the example of Darülaceze, which has been providing long-term care for 130 years throughout a sustainable economic model. The care model of Darülaceze rooted in its long history. To begin our panel, I would like to give the first floor to Ms. Gülce Tunç. She is the Vice President of Darülaceze and also a medical doctor. Could you please elaborate on medical care provided in Darülaceze? You have 3 minutes for the statement. The floor is yours. Thank you.
Thank you. Welcome, Excellencies and distinguished guests. I want to tell you about healthcare services at Darülaceze today. From the first day, Darülaceze has provided accommodation and healthcare services together to its residents. Darülaceze is one of the pioneers of institutional social medicine in Turkey. It is an early model of geriatric, palliative care, and chronic patient management. It has established healthcare services on the basis of human dignity and compassion. Initially, Darülaceze Hospital housed internal medicine, surgical physicians, dentists, a pharmacy, a laboratory, and an X-ray unit even for both acute and chronic illnesses, and even performed many different surgeries. Darülaceze has also provided healthcare services to numerous mothers and babies. It is one of Istanbul's first orphanages. Imagine a garden where children and elderly people are all together. We are talking about a social service intertwined with healthcare that has continued for 130 years uninterruptedly, even during World War I, despite shortages of medicines and medical supplies. With the increase in the number of hospitals in Istanbul over time, healthcare services within Darülaceze have shifted more towards chronic disease monitoring and disability care. When we come to present day, additionally, we started to provide specialized dementia care and palliative care services. Now, Darülaceze currently has two different locations in Istanbul. One is the historic Ok Meydanı campus, and the other one is modern one, Arnavutköy Social Service City. In Ok Meydanı campus, there are 320 elderly residents in total. 125 of them are bedridden, and there are 23 infants under state protection between 0 to 3 years old. We have 9 doctors, 25 nurses, 122 care staff, 2 gerontologists, 2 psychologists, 2 physiotherapists, 2 dietitians, and 9 social workers. In Arnavutköy campus, there are 338 residents. 60 of them have dementia. They are served by 4 doctors, 18 nurses, 75 caregivers, 2 psychologists, 2 physiotherapists, and 4 social workers. Arnavutköy campus also houses a newly opening palliative care center with a capacity of 274 beds. I would like to talk a little bit more about our Alzheimer dementia special care center, because care is a factor that directly affects the quality of life for dementia patients. And dementia care is a multidisciplinary work. And Darülaceze Arnavutköy Social Service City is a place where experts from many different disciplines, so both Dementia Special Care Center and Palliative Care Center of Darülaceze are important steps for the future, I think. At the end, we can say Darülaceze represents a model that will reduce the burden on the hospitals caused by the increasing need for palliative care and dementia care, which is growing in parallel with the increasing elderly population. Thank you for listening.
We thank Ms. Tunç for her contribution. Providing medical support in long-term care is of great importance. I would like to give the next floor to Mr. Ekin Barış Şah. Mr. Shah was worked as a project manager at Darülaceze. Mr. Shah, Ms. Islam spoke about social solidarity at Darülaceze. Could you please inform us about the economic sustainability of the institution and its resource of funding? Thank you.
Dear Excellencies and distinguished guests, thank you. It is a privilege to contribute to this event. At Darülaceze, we answered your question with a model practiced for over a century. We call it a social solidarity-based endowment. It is a financial ecosystem that connects two groups of people who usually never meet, those with means and those in need. Let me explain how this mechanism works. You can also check from the screen. First, we have what we call contributing residents. These are individuals who have assets, but they need care, security, and comfort. They donate these assets to our institution. In return, we guarantee them lifelong care. They are safe, comfortable, and looked after until their last breath. Their contribution does not stop there. These assets are gathered into a pool assets fund. This fund acts as an economic engine. It builds a financial buffer that protects the institution against economic downturns and inflation, which is very common in developing countries. This brings me to the most critical part of our model, the cross-subsidy. The income generated from the assets of our wealthy residents flows directly to the other side of the equation, the supported residents. These are vulnerable members of our society who cannot afford care. Thanks to the assets pooled by contributing residents, we are able to provide these vulnerable residents with the exact same high standard of services like housing, health, and rehabilitation with no or minimal payment. Essentially, the peace of mind of one group ensures the dignity of the other, as Ms. Keita and Mr. Abdullayev said about Darülaceze before. However, this internal engine is only a part of the equation. We fundamentally rely on the support of the public. This support reaches us via cash donations, real estate, or in-kind donations. It is important to note that only 10% of our residents are contributing residents. You might look at this structure and ask a critical question. While around 90% of our residents are supported residents, how is it possible to successfully finance such a model? The answer lies in the social impact we have created over 130 years of service built entirely on trust and reliability. We operate within the impact economy framework, where organizations create social and environmental outcomes alongside financial returns. So what are the impacts we create? First, we reduce the burden on public systems. Second, we serve as a hub for civic engagement. Third, our open contribution model enhances transparency. Fourth, we offer corporations a meaningful channel for social responsibility. This is our proven model. Thank you very much for your time and attention.
Mr. Shah, thank you for your contribution. I would like to give the statement to Mr. Asim Iftikhar Ahmed, the permanent representative of Pakistan. Mr. Ahmed, Darülaceze model implies social solidarity, philanthropy, and voluntarism. How the similar tradition of social solidarity and voluntarism in Pakistan's social care system? For your statement, you have 5 minutes. The floor is yours. Thank you.
You're being generous with the time. Others were given 3 minutes. So thank you so much. I'll try to finish early. But it's really a pleasure and honor for me to be part of this discussion that has been initiated by the permanent mission of Türkiye and supported by Pakistan, Qatar, and Azerbaijan to come to this table and to discuss the best practices that we can learn from this very inspiring model of Darülaceze. We have this word in Urdu also, ajazi. And I would like to convey our appreciation at the very outset to the distinguished ministers for their kind presence. That also shows, it testifies to the importance that you attach to this important subject. I can say, having listened to colleagues before and the ministers, that compassion and social solidarity are the two key words here. And if we look at the illustrious history of Darülaceze, it really is a powerful testament how compassion, when anchored in social solidarity and public trust, can be transformed into a lasting mission. That's really remarkable. And this resonates deeply with our own experience in Pakistan, where similar traditions are embedded not only in public policy but also in the moral and social fabric of society. So I can share some experiences from Pakistan. For example, at the government level, Pakistan has sought to institutionalize social solidarity through large-scale, long-term, people-centric social protection systems. And the Benazir Income Support Program, which is named after our former Prime Minister, Benazir Bhutto, is a cornerstone of these efforts. It is financed through federal budget. It provides targeted cash transfers to millions of low-income households, primarily headed by women. And it serves as a vital instrument for poverty alleviation, income security, and social inclusion. And apart from this, we have had for decades, for example, Pakistan Baitul Mal, which plays a crucial role in supporting the elderly, especially women, persons with disabilities, orphans, and individuals without family care. And its services, which include residential care homes, medical assistance, rehabilitation, and vocational training, are sustained through a combination of government allocations and zakat and charitable endowments and voluntary donations. And alongside these public systems, Pakistan also benefits from a deeply rooted tradition of organized philanthropy and volunteerism that enjoys global recognition. For example, the Eidi Foundation. It stands as a universal symbol of humanitarian service, operating shelters, ambulances, old age homes, and emergency response networks almost entirely through private donations and volunteer commitment. And we have also a range of nationally respected charitable trusts, faith-based organizations, and social welfare foundations that contribute to long-term care and health services. And we have a very dynamic private sector that is also increasingly engaged through corporate social responsibility initiatives and supporting care facilities, health services, and community-based programs in partnership with the civil society. So what unites these diverse efforts, much like the Darülaceze model and also the projects that we have heard about from Qatar and Azerbaijan, is a shared ethical foundation and principles of compassion, dignity, and collective responsibility. So I would like to conclude here, ladies and gentlemen, but I would like to offer two brief recommendations. First, we would like to urge the UN and international financial institutions to elevate solidarity-based care models from mere good practices to global policy by supporting their systematic documentation and technical assistance, sustainable financing, and scaling as integral pillars of inclusive social development. And secondly, to reinforce what we are doing here today, strengthening cooperation, particularly South-South cooperation, is a way to exchange practical experiences, financing approaches, and governance models for inclusive long-term care systems. So finally, I would like to end with the same words that I started with. I believe that these experiences remind us of a simple yet eternal truth, that societies endure not because of what they possess, but because of how they share and care. And that comes with compassion. So let's continue to work together with compassion to maximize sharing and caring. I thank you very much.
Thank you for your contribution, Mr. Ahmet. I would like to give the next statement to Ms. Ondina Blocker-Drobic, Ambassador, Deputy Permanent Representative of Slovenia. Slovenia introduced a new long-term care system a few years ago. How does it work in practice? The floor is yours. Thank you.
Thank you very much. With all protocol observed, thank you very much for the invitation to participate as a panelist in this really interesting and important event. Slovenia, like any other, I think, country in Europe, of course, is facing with the challenge of aging population, which is aging faster than our systems that we had, systems of social protection and healthcare that we established, of course, decades ago. So it called basically not for just adaptation or changes or amendment, but it called for a fundamental review of how we organize care, how we make it accessible, how we make it, very important, financially sustainable, and how we make it high quality and people-centered. So yes, we have, after more than 2 decades, I think, of discussion in the country, finally adopted the legislation, and we are now in a very intensive phase of implementing this legislation of a new long-term care system whose central objective is to establish a system that is integrated and coherent. Because for many years, the long-term care in Slovenia was very fragmented, especially between the health and the social sectors or services. And different financing resources, different delivery structures, and as the result of that, people who were in need or their family members were basically left to themselves to navigate this very complex and very complicated system. So after, as I said, more than 20 years, we have launched the actual implementation of this legislation and introducing systematic mechanism to connect both existing structures, but also to introduce the new ones. So we are now in the 3rd year of building this new, let's say, comprehensive and integrated long-term care system. It basically marks a significant shift in our understanding of the long care term system as the 5th pillar of social security system, which is financed through assessed contributions. The assessed contributions and the payment of those started in, I think, July of last year. So we had a couple of months of experience right now. We have also established the entry points at so-called social centers, which serve as the entry point for any individual or their family and their family members to navigate and also to learn about the correct procedures and also to learn about the rights. So the new let's say that the key features of this new legislation are, or the reform, are the long-term, so-called the long-term care coordinator, who acts as the central professional link between the user and the system, and the individual care plan, which operationalizes the principles of a person or a people-centered care. So with these changes, we hope that we are not only transforming the legislative framework, but also the conceptual approach to long-term care, shifting from institutional dependency to coordinated, to empowering individual support, and hopefully a comprehensive one. So we are moving from a system which, by the way, was always based on solidarity. That's not new. However, we are moving from a system that was centered on institutions and now focuses on an individual, on a person, their autonomy and their capacity and their ability, most of all, to make decisions about their own life. I think this is the key issue, to give a person their dignity. So the way we understand the long-term care means the cross-sectoral coordination. It also means cross-sectoral cooperation, especially among health and social services, which are, of course, the most needed, but also the community actors on both, let's say, state, but in particular on local level, because these social centers and the centers for people who need long-term care and are outside of their families, still a lot of care is within the family, so-called home-based. However, for everybody else, this localization, so to say, is very important for the people to be exercised in the environment that they know and that they are familiar with. Thank you very much.
Thank you for your contribution, Mr. Drobic. Now, I would like to give the floor to Mr. Stefan Pretover, the Deputy Permanent Representative of Austria. Mr. Pretover, how does Austria translate social solidarity and public funding into high-quality, inclusive long-term care in practice? The floor is yours. Thank you.
Thank you, Madam Moderator, Ministers, Madam Undersecretary General, Excellencies, dear colleagues. First of all, I would like to thank the Permanent Mission of Türkiye for the initiative, and for Austria it's an honor to be one of the co-organizers of today's event, and for me personally it's an honor to be one of the panelists. And I think that it's really important to engage in this discussion today, and I'm grateful to engage, because I really think that aging and care are global challenges, and they require coordinated multilateral responses. So I think this discussion is very timely on the sidelines of the Commission for Social Development. So, but now to your question, for Austria, advancing inclusive, high quality, and solidarity-based. We talked a lot about solidarity as well. Long-term care is a clear policy priority. And I just want to mention a couple of specific elements of our strategy. In Austria, we operate a universal long-term care allowance, and this one is financed through general taxation and is granted independently of personal assets. And this system includes both financial benefits and publicly organized services, such as home care, mobile services, and residential care, delivered primarily by public but also non-profit providers. We place a strong emphasis on supporting informal and family carers through paid care leave, social insurance coverage, and financial support for live-in care, helping families balance work and care responsibilities as much as possible. We've introduced a new system of community nursing. It's been institutionalized to strengthen the preventive care, early outreach and guidance for older persons and their carers at community level, and it's a model of locally based professional nursing. And then I also wanted to mention a recent reform focus, which is on strengthening the long-term care workforce, including improved working conditions for them, and so both for professional carers and family carers as well. And since I know we are short of time, I just wanted to say a few words on something which is very unique. In Austria, we have the so-called system of social partnership. So it's a formal system in which the government, employers, and workers' organizations jointly shape social policy through early negotiations and consensus. And in long-term care, this ensures that care standards, funding, and working conditions are developed collaboratively, with collective agreements securing fair wages, training, and stable employment for care workers. And this coordinated approach we have been applying for decades across national and regional levels helps us to reduce fragmentation and helps to guarantee a high-quality, inclusive, and sustainable long-term care. That's what I wanted to share with you, and thanks. Back to you, Madam Moderator.
Thank you so much, Mr. Pretover. I would like to give the last panel floor to Dr. Sintina Stuyan. Ms. Stuyan is the main United Nations representative for the International Federation on Aging. Ms. Stuyan, in your opinion, how can we make long-term care model sustainable and integrate them with social solidarity? Thank you very much.
Thank you, and Your Excellencies, to all of you who have joined me on this panel, I'm in awe of what all is being done and the great models that you're promoting. But on behalf of the IFA, the International Federation on Aging, we do have ECOSOC status, but we also have a collaborative relationship with the World Health Organization. And so we're very aware of the transformational trends shaping the world stage. Population aging, increased longevity, increased dependency in care, chronic illnesses, disabling conditions, migration, especially during times of war and crisis. They all tend to erode the family support structures, all of which contribute to the burgeoning issue that the long-term care system are facing. Let me begin by stating that population aging is not a future challenge. It is a present structural challenge, hitting different countries at different rates, but all the same, a burgeoning issue to be celebrated. And let me say that that is not a burden, it is a transformational opportunity. And whether societies thrive or fracture very much depends on whether we design systems that uphold the rights, the dignity, and the participation of older persons in enabling healthy aging across the life course. We are halfway through the decade of healthy aging. So stock taking is kind of important. To review for you, there are 4 main pillars of that decade. 1, combating ageism. 2, creating age-friendly communities and environments, delivering integrated care, and ensuring access to long-term care. Looking at the model program components for healthy aging, we see that really all 4 of those pillars are very interconnected. And if we just look at the first one, combating ageism, we see how older persons can be left behind if not addressing half of the world population that hold ageist attitudes against older persons. But building age-friendly environments is very encouraging for their accessibility, for the intergenerational opportunities and community that it can deliver. So looking at how integrated systems can help us, it's really important to also not forget the very last pillar about ensuring access to long-term care. So all of the pillars, as has been mentioned before, really have to be integrated themselves. And I believe that the Darülaceze is a good model that can be adapted and looked at, but one of many that has to have adaptations to meet the cultural and norms of a specific country. I want to just share a few highlights from a recent survey, a global survey of older persons that the IFA conducted. We had 911 respondents in the ages 60 to 94 across 58 countries and in all the WHO regions. The findings show that older persons strongly believe that they have valuable contributions to make, but feel undervalued by society and face persistent ageism in policy and consultation processes and lack positive representation in the media. While many feel included in their communities through intergenerational activities, there are significant barriers that remain in transportation, access to information, particularly in the digital space, and social participation, and again, particularly in more rural areas. Access to health care is widely perceived as inadequate due to high costs, long waiting times, poor quality services, and limited preventive health measures, alongside the major gaps of uncertainty in long-term care systems. So the burden of the informal, unpaid caregiving is high, with many respondents currently providing care themselves or are feeling they will be expected to provide the care for their loved ones, of course, and in their own community. At the same time, the survey identified strong opportunities for integrated care pathways, public-private partnerships, labor productivity, prevention and lifestyle science, technological transformation, and intergenerational programs, thus positioning demographic change as a catalyst for innovation and investment rather than as a burden. Over 1/3 of the persons reporting that services were not available or inadequate in their own community to provide long-term care. That included home-based care, community care, residential care. 46% expect to receive care from their loved one in the future, and 45% currently provide care or support to family, friends, and loved ones. So responses indicate a high level of worry and uncertainty about care, including the challenges around cost, access, lack of quality services, and the treatment of and challenges of being carers as well as recipients of care. Overall, I think the survey findings highlighted a significant gap between the global policy and local action, and we need to strengthen that infrastructure. And I think it's a start here with the Commission on the Status of Women, on the Commission on the Social Development, but next month when we get into the Commission on the Status of Women, that's equally an important venue for us to address the issues of equity. So I think in closing, I would just like to say that it's really taking maybe the view, the long view, as was referenced before, about aging is about all of us, and it begins at birth, and it ends when we leave this planet, right? But if we can learn anything from the disability community that was successful on getting a convention on the rights of persons with disability, let's remember nothing about us, older persons, without us. Thank you.
Thank you, Ms. Tuyen, for your contribution. Honorable Minister, Deputy Minister, dear guests, I would like to thank all our panelists for their contribution. Finally, I want to give the last statement to Ms. Islam.
I would like to take this opportunity to thank Permanent Mission of Türkiye for the organization. My gratitude towards honorable ministers, especially Minister of Family and Social Services of Türkiye, Her Excellency Mahinur Özdemir Göktaş for her auspices, and Her Excellency USG Ms. Keita, and all contributors who spent this afternoon for the future of humanity, which relies on social solidarity and altruism. I think it will be the next big thing for the century. Thank you.